Back with another one. We gotta talk about it. I'm gonna keep it on COVID. Whatever the fuck it's called, COVID-19. All right, man. All right, man. I don't know. I'm just gonna say my thoughts, man. I just like talking about it. All right, Texas, California, and Florida see COVID-19 cases skyrocket. All right.
In the nation's three most populous states, things are going from bad to worse.
The three most populous states, from bad to worse. All right. That's a program right there. They programming you. All right. So when you have watched this news story, don't believe one look at what they saying. Okay? Because listen to what they start saying.
I don't think history is to look back forgivingly upon the United States and Americans for going down this road.
California, Florida, and Texas breaking records for new cases in a single day. Texas pausing its reopening to, quote, corral the spread of COVID-19.
You see, they're just showing, like, they show the ambulance driving. Remember, that's the mind control right there. That's the program. And they showing inside a hospital. See, that's the mind control. The program. So what, you see an ambulance driving? Who gives a fuck? I see ambulance driving every day with their sirens on. So I'm supposed to think somebody got COVID in this? Get the fuck out of here. Because he's showing a hospital. So I'm supposed to think it's COVID victims in there? Get the fuck out of here. That shit don't work on me. Alright? Yo, this is what they might... Yo, this is how stupid people are. Alright? The government and the media, you saw how quick they flipped the script to racism, just like that. Now they going back to COVID. You know what they could say next week? When you driving your car, well, whoever's driving a car, whatever vehicle, to smoke out the tailpipe killed 88 people. Don't drive no more. You know, nobody won't drive no more because of that. That's all they gotta say. That's how stupid people are. They can say anything. They could just make up anything, like they made up this virus, and people believe it. They told you to wear a mask. A mask never saved my life, ever. How a mask could save my life? I'd like to know. I never knew a mask could save your life, man. Get the fuck out of here with y'all dumb shit. A mask could save my life. What the fuck they be talking about, man? Get out of here. And surgical gloves could save my life. Yo, alright, I'll be laughing because I know it's horse shit. Alright, let's go.
The greater Houston area, Texas Medical Center's normal ICU capacity is just over 1,300 beds. They currently have 5 available.
We're running out of that time.
So they only got 5 beds left. And he's saying they're running out of time. So why the fuck you not working right now, but you talking to these motherfuckers? Man, come on, man. Get out of here.
The runway is short, and our healthcare system is filling up, and we need to do everything we can as a community to fight this pandemic.
Right. One of the best ways to fight COVID-19.
Look. What the fuck this at? This is China, right? This ain't fucking America, because in China they wear masks anyway. They've been wearing masks out there. Like I said in my other video, when I was talking about it, the reason they started it in China, because they could have video of people with masks on. That's all. It's all a mind thing. It's all a mind thing. They got you conditioned to wear a mask now. Wow. In 5 motherfucking months. in America, they condition people to wear a fucking mask. That's ridiculous.
Wear a mask. I think it's incredibly unfortunate that this has become so political.
You know, that's what I always laughed. When these motherfuckers talking on the mic, they don't have a mask on. But they tell you to... Yo, these people on this planet is dumb, man. Now they mad because they eating together. Why y'all mad because these people eating? Like, come on.
There's no statewide mandate in Florida, where more than 5,000 cases were added Thursday.
It is scary here. Younger people are getting sick.
Face coverings.
That's what I'm saying. See, now they saying younger people. See here what they saying? Now younger people getting sick from coronavirus. Wow. What Trump said, how many... Yo, he be saying some funny shit. He said this virus has the most names. Yo, he be saying some funny shit sometimes. Oh, yo, that shit is funny. Yo, this fucking virus got like 40 names.
Are required in hard-hit Miami, where the mayor is now considering fines for anyone who ignores his order.
Wow. He gonna consider a fine if they ignore his order. He telling you to wear a mask while it's hot as a motherfucker. You're gonna faint and shit. Yo, he telling you to wear a mask so you gonna faint and shit. Yo, man, I'm about to faint, motherfucker. I gotta take it. No, you take it off, we gonna fine you. Like, come on, man. Get the fuck out of here.
We don't want to go backwards. The only option that we have right now is to order masks in public.
This afternoon, the CDC announcing the actual number of infected Americans could be 10 times higher, roughly 20 million people.
It's about 10.
Wow. See, I'm just saying, like I was saying before, see what they saying? Now, they said it's more than what they thought, so it's 20 million people. Wow. Yo, they just could say anything, man. Like I said, they could say from the vehicle tailpipes, the smoke is killing people. It killed 88 people. Don't drive no more. I bet you nobody will drive. Till we get this settled, you can't drive. Nobody should be driving on the road for the next 30 days. And nobody will drive. Wow. That's what... They could tell you anything. They could say, when you wear a hat, this is... Yo, they could say that. Yo, they could say anything. If you wear a hat, you know... It's germs in the hat, and it go into your hair. Then you'll get sick. Nobody wears a hat ever again until further notice. You know, nobody will wear a hat no more until further notice. That's how people are brain control. Because they told you it's a virus in the air. If you walk past somebody and cough, you might can die within a week. Like, come on, man. Get out of here. Or you will catch a virus. Or you will catch a virus if it's more than 10 of y'all in one place. Wow. See how they conditioned these motherfuckers? And it's no turning back now because there's too many people conditioned. The ones who trying to fight back, it's too late, man. Y'all fucked it up. Like I said before, they fucked everything up, the sheeple. Because they stupid.
Sometimes more people have antibodies.
New concern for pregnant women. The CDC reporting that...
See what they say? I'm telling you, they keep pushing it now. Pregnant women are concerned, too, now. Wow. Everything is a concern. If you go outside, it's a concern. Now, if you're pregnant, it's a concern. If you got a headache, it's a symptom. If you got the sniffles, it's a symptom. Wow.
They may be at higher risk for severe COVID-19 illness, especially Black and Hispanic women.
Wow. See what? Like I said, let's listen to what they say. Only it's a more risk to Black and Hispanic women when they pregnant, but not to white women, Asian women, Russian women. Who else? How many races? All right, all right. Let's keep it at that. In other words, it's only Black and Hispanic, and everybody else, they not a risk when they pregnant. See how they do that race shit? So some Black motherfuckers gonna say, yo, man, y'all think they trying to kill us. That's what it is. Black motherfuckers with no brain. No, that's all to make you mad, dumb motherfucker. Alright, that's all it is. It's a psychological operation to see how you react to it. If you react like a dickhead and believe them, they got you. But me, I know it's bullshit. They can't fuck with me. Alright? They can't fuck with me. Cause I know it's bullshit. So don't come with that dumb shit. What y'all be saying. Cause there's no motherfucking virus.
The agency also noting more young people are being infected and obese Americans, not just the...
Now obese Americans is being more affected. And young, like I said, remember, like they said it didn't come to the young people. But now it hits the young people. Now if you obese, like I said, it's everything. Soon they're going to say if you're 5'11", you can get it. If you're 6... No, remember, the basketball players are getting it. If you're 6 feet and over, you can get it. They gonna say some dumb shit every day. Alright, man, come on, man. Stop believing this stupid shit. If you wear a size 9, you can get it. They just making up shit every day. Now, obesity. Like, come on, man. Get out of here.
morbidly obese are at higher risk. This as new hotspots describe a scene that sounds eerily similar to New York in late March.
We are exhausted, reusing PPE, doubling our drive-through capacity, doubling our respiratory capacity, and it isn't enough.
There is such a renewed focus in many ways on hospitalizations, on ICU admissions in California, where the number of new cases reported today is down from that high of more than 7,000 yesterday. It was still over 5,300, and that is a massive number in the state. Hospitalizations and ICU care there is also up, and Governor Newsom saying just a short time ago that he's watching those numbers very carefully. And if...
Yo, this is my point. I mean, this is why I be thinking, like, all right, if it's just, I know it ain't no virus, but if it's so serious, why does lady on the left don't have a mask on? She got to, and she bring her script. Why? If it's so serious. Like, that's what I be saying. Like, come on, man. One news reporter have one on, then the next one don't have one on. Like, come on now. If it's that serious, y'all telling people to wear the shit, but y'all not wearing it. Like, get the fuck out of here. See, that's what I understand. Why does people be going for this dumb shit? Like, y'all motherfuckers is stupid.
When COVID patients begin to strain the resources in hospitals and specifically ICU beds, the governor says he will consider then pulling back the reopening in his state, Jake.
All right, Erica Hill in New York, thank you so much. Joining me now, CNN chief medical correspondent Dr. Sanjay Gupta. Sanjay, I mean, all of this was not only predictable, it was predicted by you and other health experts on this show and others.
He said it was predicted by him and other health experts. No, it was predicted by me too and others, because that's what y'all doing in your script. It's easy. But you don't want nobody to see my channel and shit. And you don't want people to see other people's channel. It's easy. It's been predicted. We know what y'all gonna do. It's not that it's predicted. That's what y'all do. Well, you think y'all gonna have the virus for 4 or 5 months in America and then that's it? No. Y'all gonna let it chill for a while. People get relaxed. The sheep will get relaxed. Then bang, y'all come back with a second wave. Oh, everybody shouldn't have been outside. See, you came out too soon. You know what I'm saying? Y'all gotta go back in now. We have more deaths than ever. See? I said that before y'all coming saying what y'all saying. You know what I'm saying? Like, come on, man. It's too easy, man. Y'all too predictable. Alright? And they did a fake little terrorist attack. I mean, it was terrorism. It was a stabbing somewhere. I forgot. I ain't even doing a video on that. I don't know if I'm gonna do a video on it. I might. I don't know. But yeah. Alright, they all full of shit, man.
Why do you think we're seeing such spikes in cases and hospitalizations in Florida, California, Texas, which really, to be honest, had different approaches to tackling the virus?
Yeah, I think that all of them, the thing that they do share in common, though, Jake, was none of them met these gating criteria that we talked about before they reopened. I mean, some closed sooner than others. Some have been more diligent about talking about masks. But look at these gating criteria. New cases down for 14 days. Why is that? Because you can then take from what's called a mitigation phase, where you're just trying to slow things down, to containment, to saying, I'm going to get my arms around this virus. If you have the case numbers going down 14 days, you're much more likely to be able to do that. And the bottom line is put that in sufficient testing program in place. Can you get tested if you need to get tested, or if you want to get tested? Everyone that wants to get tested can get tested. That's still not true, no matter where you live in the country. And Jake, the whole country sort of started late. So no matter where you are, California or Florida or Texas, there was a lot more cases in these states than I think anybody realized before we started doing anything at all in terms of staying at home.
And we pointed out on this show and others that none of the states that were reopening had met those gating criteria, not one of them.
Wow. We got these two imbeciles talking like they know everything. Like, why would you fucking co-sign with this dumb shit, what they saying? That's what make me really upset. People sit there and you co-signing with these idiots? They telling you what's happening. And these motherfuckers didn't budge nowhere. They ain't go nowhere. All they did was sat in that motherfucking studio. And how the fuck they know everything going on? You know how? Because they got fed a script to read. Alright? Come on, man. These motherfuckers ain't going nowhere. And you sitting here co-signing with them? They ain't going to no hospitals. They ain't see nobody die from the shit. And you fuck them. Sitting there co-signing. Man, you gotta be a dumb motherfucker. Oh, let's go.
Deaths are a lagging indicator, which means that first you see the cases, then you see the hospitalizations, then you see the deaths. Are you expecting to see a sharp increase in the death toll in the coming weeks?
We are going to see more deaths. I think there's no question just by seeing what's happening.
Look at this guy, fucking liar. He say we gonna see no death, no question. This motherfucker don't even go anywhere. All you do is sit in the fucking studio. Alright? Alright, let's go.
In the hospitals. I think there's a couple of points, though. One is that we have learned some lessons from the last couple of months, Jake. Ventilators, for example, may not be a great option for a lot of these patients because it doesn't seem to be associated with much improved mortality. We have a couple of medications that are in the mix now, including one that's more widely available, this dexamethasone, and obviously remdesivir, harder to get, but that could have an impact, a positive impact.
Shut the fuck up. Talking about they got some medicine. They already got the vaccine. He just telling you bullshit right now. All right, they already got the vaccine they're going to affect the people with. All right? They already got it. He just telling you bullshit. All right? They already made this shit probably last year or 2 years ago. I don't know when they made it, but they been made it already. Because they knew they was coming out with this shit. All right? They didn't think it'll work. In America, they didn't think it'll work in America. That's why they started in China. They didn't think it'll work. They said, well, we could start it in China. We'll start the hoax off at. You know why? Because they wear masks already. I'm going to keep saying the same shit. So we can get video with people with masks on. And they showing, some of that shit be from 4 years ago, them mask videos. I don't even know if I uploaded that video, because I did a video about it. I don't even know if I uploaded. No, I did upload that video. When it was how do people wear masks in China. From like fucking 3-4 years ago. I think I did upload it. Yeah, but, yeah. That's it. That's a talk shit, man. I can't believe people going for it, but it's hard to get in people's head. They said it's crazy out here. All right? People dying, but they ain't seen nobody die. But because they watch idiots like him on TV, these motherfuckers who don't even move from the studio, they telling you everything, what to do. Get the fuck out of here.
Impact on mortality overall. I think the big issue, Jake, is really, if you look at what happened in Italy initially, why was mortality rate hovering around close to 10% at one point? It wasn't because the virus suddenly became more severe. It was because people couldn't get into the hospital and get the care. That's what I'm really worried.
Wow. See this bullshit they be saying? He said the only reason it went down, what he said, Europe, whatever the fuck he said, England, Europe, whatever he said, the reason it went down because the people couldn't get to the hospital. So that meaning it was people affected, but they couldn't get to the hospital. I don't know why they couldn't get there, but all of a sudden they got there. Yo, what is this? A fucking Saturday Night Live skit or something? What the fuck they be saying, man? That's what they're gonna say about NYC. Oh, it went down. The reason it went down because a lot of people didn't get tested. That's what they're gonna say. That's all they're gonna say. Yo, every fucking commercial about this shit. This shit only been out 5 fucking months in America. 5, 6, whatever it is. They got all these commercials, all these billboards, all these computer graphics, wherever you go. Wear masks. Stay safe. Stay 6 feet away. That's all you hear. Like, get the fuck out of here with that horse shit.
About in places like Houston, specifically in Texas, and several places in Florida where my parents live, if the hospitals become too full, people will die unnecessarily.
The hospitals ain't full. Shut the fuck up. The hospital's too full. Shut the fuck up. They already been exposed. Alright? Shut the fuck up, you lying motherfucker. Oh my God.
And that's going to obviously sad, tragic, but will also drive up the mortality rates.
Yeah, shut up.
And Sanjay, we're just looking at the chart there. There's 2.4 million total cases in the United States that we know of, confirmed cases. The CDC said today that their rough estimates are that there's actually 10 times as many cases than that.
I said that in the last video. Yeah. Now the CDC telling bullshit now. The CDC told the truth before. Now they gotta go back on their word. First they said they labeling COVID victims even if they don't have COVID. But now they saying it's a They went up to 20 million. See, now they lying. Well, they was lying before about the COVID. Either way, they lying, right? Because they say they not dying of COVID. They died of something else. So they lying there. Well, they lying, period. CDC can't be trusted. All right? If you believe CDC, I can't fuck with you. Because you're a dumb motherfucker. All right, let's go.
So 20 million because of asymptomatic carriers. That's stunning, and it also suggests that these individuals, if they're asymptomatic, are spreading the virus to some people who won't be asymptomatic.
Wow.
That's right. And part of this, I mean, is a fundamental problem that we haven't been.
These motherfuckers that's talking bullshit. They saying people that's spreading the virus. How? Cause they was in the supermarket together. They was at the club together. I mean, not the club, the bar. They was in the there was too many people in one section. Come on, man. You can't be a dummy believing dumb shit like that. Cause they still got Walmart open. There's a lot of people that be in there. Fuck out of here. Yo, man, they just be talking dumb shit all day.
Testing enough. I mean, I know I beat the drum on that every single time, and people are sick of hearing it, but these numbers wouldn't be nearly as high, these projections wouldn't be nearly as high if we had been testing aggressively early.
Did I say that earlier? That's what they're going to start saying. A lot of people are getting tested. That's why New York is going to go back up. Well, every state going to go back up. Yo, a lot of people are getting tested. But all of a sudden, people got tested. These motherfuckers are so clowns. So they saying people spreading the virus, right? So y'all testing people then. So how the fuck y'all know they got the virus? In Texas, California. So y'all testing people. So what the fuck you talking about? So New York gonna go up probably next month or the month after. That mean y'all testing people. That's how y'all know, right? Come on, man. These motherfuckers is full of shit. They talk dumb shit. And people sit there and co-sign with it. Because the only way they can know if they got it, they tested them. What? Oh my gosh. I don't understand why people don't listen to what the fuck they saying. Oh my.
Now young people getting tested that couldn't get tested before, so that is accounting for some of what the CDC...
Now young people getting tested who couldn't get tested before. But you just said nobody getting tested, now they getting tested. Man, shut the fuck up.
Is saying, but there's no question you have a significant population out there that have no idea that they are carrying the virus in their bodies right now.
Look. So I didn't get tested. I have no idea I got it, right? Shut the fuck up. Alright? I ain't got shit. Like you two idiots ain't got shit. Nobody across America, over the world ain't got shit. Alright? You piece of shits. Talking that bullshit all day. Alright?